one of the questions that we've been talking a lot about, and it touched upon in the presentation I gave, it was just around advice around physical distancing. And we know that schools are opening and camps are opening, whether it be day camps versus night camps. And Karen, we just wanted to get your thoughts on what instructions you're giving to patients and caregivers regarding physical distancing.
So that's a very good question because we do get that quite often. So we actually direct them to the CCC website. There's a nice summary of caregiver options that they can share with their employer. And so it actually clearly outlines there that if you're a caregiver caring for somebody who is immunocompromised, that you can ask for accommodations through your employer for modified work duty. And in some cases where the employer would need something more, tangible, like a letter from us, we've actually offered that service as well. But the most straightforward is asking these caregivers to share the CCC link with their employers. And I think we probably know of a person or a neighbor of a person who's who's a frontline worker who has IBD. So we would also give that same same principle advice around precautionary measures that they do have to exercise, with them being immunocompromised as well. So that's a sort of the general advice that we give. And I think it's sort of across, like globally, not just CCC. Even if you look at sort of the IOIBD website, it's all there. It's a guidance that they provide. Did you ask me about camps or schools as well, or?
Yeah, we'd love to get your perspective on that.
Yeah, for sure. So I'm glad you brought that up because I think since the announcement 2 or 3 days ago from Ontario and from many places as well, that overnight camps are canceled and schools won't be reopening till the fall, we've been sort of inundated with a lot of these questions. So I'll address the school piece first because there's quite a bit of time that we had between summer and the fall opening. So I was made aware that a lot of the Ministry of Education is actually working quite closely with the with pediatric faculties or community physicians in really onboarding safe opening. So that's one, and I think we do have some time for that. And I think if we were sort of to look at models globally, what can we learn from, say, for example, countries like Denmark that just came to mind. So when they had sort of reopened, it was very tactical in that they were able, they had the resources to sort of add more sinks or more washroom and be able to really put in place certain rules. If you're outdoors, it's a cluster of 5. If you're indoors, it's a cluster of 3. So what we now know with the school openings, we have a few months to sort of work on that. Now, people feel that because the overnight camps are canceled, does that mean that that day camps, summer day camps will also be canceled? So we also know that public health is working quite closely with the Ministry of Labor, Skills and Development Department in really ensuring that onboarding of safe day camps would also follow. And I think I'd like to point out that it's quite crucial that we always keep kids or young adults in mind, because there's really certainly an influx of behavioral, social, mental, emotional issues since the lockdown. So they're quite crucial. What's I think reassuring is that, Gil, you had referred to the secure IBD and you were doing a bit of math. So probably I'll out-math you a bit, but I can't, but I'll try. So the data that you had shown, so for the age group of 0 to 9, for example, it's 4 out of 1170, so that's maybe about 0.3%. And then you sort of move over to the age group of 10 to 19, for example, and I think it was 45 out of 1170, so you're looking at maybe less than 4%. So it's reassuring that the numbers are low and kids are, by and large, not impacted significantly, but we also have to remember that kids are not risk-free. So I think what really needs to be kept in mind is really the notion of harm reduction. And so I think as pediatric nurses, what we would advise to patients or families asking about summer camps is this. If your child is immunocompromised and or belongs to a category of moderate to severe disease and immunocompromised, if I could sort of equate the 20 milligram per day of prednisone for adults, for pediatric, it'd be like 0.5 milligram per kilo per day. If you sort of belong to that category, I would err on the side of caution. Now, on the flip side, if the risk is a bit low, that probably puts them in a different category. And I would urge you that, or families, that the next time you have that virtual visit or in-person visit with your doctor, to really ask them to help you as to where categorically you would belong and how safe it is for you to really join a day camp if that is not canceled.
That's excellent. And on the same lines, there was a question from the audience, and this was more in the context of an adult going back to work, and the audience question, they essentially said their company is planning to return to work plan, and they're concerned about mitigating the risk to their exposure at work, but they also are nervous about sharing their health information with their manager, and wanted to get some advice on how to broach that topic, because it really is kind of two things. One is, how do you make sure the workplace is safe for you coming into the workplace? And number two is, what do you do when you have to share, do you have to share your health information, and what's the best way to approach that? And I won't single anyone out because it's actually a very complicated question, but I don't know if, Joan, if you're raising your hand or if they were just adjusting, but I would love to hear someone's perspective on that question.
If it's okay, I'll kind of dive into that early, because it is something we're seeing a lot of, and Alberta's rapidly becoming a have-not province, it seems, and employment right now is something that we're seeing people being vigilant to, in the fact that they're worried about going back to work. They've been asked to work from home, but they're also really concerned about their long-term employment when we're starting to look at reduction in work hours, as well as layoffs that are fairly broad. And what they don't want to do is create a situation where they're sharing information about their disease and feeling like it may make them more vulnerable to consideration around that. So one is, you don't have to share your health information. And probably one of the things that I can say myself personally, because even as somebody who doesn't have inflammatory bowel disease, but has walked into a workplace that some people would say would be of concern, in the fact that I've been working in the acute care facility, is even in an acute care hospital, we're not seeing outbreaks right now in Canada. And in fact, the acute care staff is really pretty unaffected by this. It's not an absolute. There has been people who've contacted COVID, but the rate is quite low. So what that tells us is even in situations where we're in contact with the public, we're in contact not with our own family units, using good hand hygiene works. Wearing a mask works. Being cognizant when you can of social distancing is effective. So I think that those are things that have been really clearly stated across the country by all of the medical officers of health, and it's common information that's shared, that as you're entering back into your workplace, one, clean your workspace. Bring in Lysol wipes, or if you don't have Lysol wipes, bring in a wet cloth that is affected with soap and water, and wipe your workplace every day. Wipe down your phone, make sure you're comfortable that your space is clean. You don't need to wear gloves. I'm not a fan of gloves. I believe you need to wash your hands. And the risk of wearing gloves in the workplace is, and I see this all the time in retail, if you pay attention to it, is people wear gloves and they become overly confident and they forget to wash their hands. So wash your hands. Don't touch your face. And if you have access to a mask, it's reasonable that you wear a mask. And remember that wearing a non-medical grade mask is really to protect the people around you more than to protect you. I think the biggest advantage as an individual wearing a mask is it keeps you from touching your face. And there is value in that. So really just hold your workplace to the standards that have been very eloquently outlined by the medical officers of health.
And the one thing I would add, and I tried to explain this in those examples of the clusters, is that a safe workspace is relevant to everyone, whether you have IBD or you don't. We recognize in society, some people are taking this at different gradients of seriousness. If you have IBD, you're watching this webinar, you clearly are invested, you are worried, and you don't have to necessarily go to your work and explain your health reasons, but you can be an advocate for you. And to be honest, you're likely to be an advocate for a number of other people who may also have reasons that they're vulnerable or they're just scared and nervous. And if you can, talk about what you expect at your workplace, that again is all around safety to protect you and your colleagues. I mean, that's what you should be going forward, and not have to necessarily disclose that you have Crohn's disease or you're on a biologic. That should be secondary to the safety of your workspace.
I just wanted to add on to what Joan was talking about. Not all of us have the ability to work from home, and we do need to get in there. So I've worked a lot with my patients with letters to employers regarding accommodation or modified duties. My other hat during the pandemic has been working with our occupational health department. So I've had a bit of experience in helping patients negotiate some of the concerns they have with their employers. One example is, I have some patients that work within the hospital that are on biologics and immunosuppressants, and they're very concerned about being there. So we've been able to try to accommodate them in that they're not working in the high risk areas, such as the emergency department, the intensive care unit, or even the COVID unit. And they've been redeployed to other areas within the facility, such as the COVID telephone line or virtual visits with other clinics. So I really encourage people to reach out to their employees because there may be other opportunities for them. Another example was a patient of mine who works as a correctional officer, and they were able to accommodate him in that he wasn't working directly with inmates, but was supervising through telecommunications and electronics. So that kept him socially isolated from the higher risk group.
And Jen, while you have you on the line, Eric was asking you earlier about the whole scenario. If you have a patient who is suspicious that they might have symptoms of COVID, what are you doing to address that scenario?
So fortunately, I have not had any patients with IBD yet have had COVID, but we do have access to swabbing and testing through our public health department in Hamilton. So we do not have access per se in our outpatient clinics to get that, but we can work with our local health department to get patients in promptly for swabbing. I know diarrhea is certainly one of the signs of COVID, but I would definitely investigate that, but also monitor for any flares or increased signs of other inflammatory bowel disease. So like Kelly had mentioned earlier, using fecal calprotectin in blood work, you always want to make sure there's no signs of other infections that people can get along with the COVID.